Your hands could be telling you something important, sometimes even about cancer. Have you ever thought about your hands as more than just tools for doing things? Well, they are actually like a second face of your body. Not only can your hands reveal your age, but they also provide clues about your overall health. When your body starts to have problems, sometimes your hands are the first to quietly send out warning signs. But because we rarely pay close attention, these signals often go unnoticed. This is why it's so crucial not to dismiss small changes in your hands as no big deal. What seems like a minor problem could actually be your body's early way of signaling something serious, even cancer, long before you feel unwell. If you catch these subtle signs early and take action, you might just be able to stop cancer in its tracks before it becomes too advanced. So please, if you notice unusual changes in your hands, don't delay. See a doctor promptly. Your hands might literally save your life. A real story: how looking at her hands helped Lisa catch lung cancer early. Let me tell you a story about Lisa, a 56-year-old woman from Ohio. One day, Lisa posted a photo on social media of her hand wearing a ring. A friend commented on the photo, saying, "Lisa, your fingers look a little unusual. You might want to get that checked out." Lisa didn't take it seriously. She thought her friend was overreacting and ignored the advice. 6 months later, Lisa was diagnosed with lung cancer. The doctor examined her hands and noted she had a classic sign called clubbing, or drumstick fingers. This condition means the tips of her fingers were enlarged and the nails curved downward, like little drumsticks or the shape of a watch glass. The doctor explained, "Lisa, these changes on your fingers have been telling us that something was wrong with your lungs for some time, probably long before your symptoms started." Lisa felt regretful, because if she had paid attention earlier, she might have caught the cancer at a less advanced stage. Why your hands can warn you about lung cancer and what to look for. Lung cancer remains one of the deadliest cancers in the United States. According to the American Cancer Society, about 236,000 people were diagnosed with lung cancer in 2022, and it caused over 130,000 deaths. That's nearly 20% of all cancer deaths. One of the reasons lung cancer is so deadly is that it often doesn't show obvious symptoms until it's already advanced, making early detection difficult. Doctors and cancer researchers in the UK and US, after analyzing tens of thousands of lung cancer cases worldwide, have identified some simple self-check methods that can help you spot early signs, even before symptoms like coughing or shortness of breath appear. One simple test is the finger clubbing check. Place the tips of your index fingers from both hands against each other, nail to nail. If you can see a small diamond-shaped gap between the nails, that's normal. But if the nails curve around and touch directly with no gap and your fingertips look round and bulbous, this is called clubbing and is a red flag. Clubbing happens when the tips of fingers or toes swell and the nails curve around, almost like they're being pushed upward by a small balloon underneath. This change in shape is often linked to lung problems, particularly lung cancer, but it's not exclusive to it. Other causes of finger clubbing you should know about. It's important not to panic. Finger clubbing can be caused by several conditions besides lung cancer, such as liver diseases like cirrhosis or liver cancer, chronic lung diseases such as emphysema, tuberculosis, or bronchiectasis, heart conditions, especially those involving low oxygen levels, like congenital heart disease, digestive system diseases, like ulcerative colitis. If you notice this sign, especially if you smoke or have chronic respiratory problems, you should see a healthcare professional immediately to find out what's going on. Other hand signs that could point to cancer or serious illness. Besides finger clubbing, there are other changes in your hands and nails that might signal underlying diseases, including cancer. 1. Palmar erythema, liver palm, and spider veins. Many middle-aged and older adults notice patches of redness on the palms, especially near the base of the thumb and pinky finger. This redness can temporarily fade when you press on it and then return afterward. Medically, this is called palmar erythema, and it often indicates liver problems. The liver's inability to break down certain hormones like estrogen leads to the dilation of small blood vessels visible in the skin. Alongside this, you might see spider veins, spider angiomas, tiny red spots with radiating lines that look like a spider web, commonly found on the face, neck, chest, and hands. These signs are common in chronic liver diseases, cirrhosis, hepatitis, fatty liver, a liver cancer, alcoholic liver disease, hormonal changes during pregnancy. If you notice these along with fatigue, loss of appetite, abdominal pain, unexplained weight loss, or yellowing of skin and eyes, jaundice, it's crucial to see a doctor for liver function tests and imaging. 2. Dark lines under the nails, possible melanoma. Some people notice a dark vertical line running from the base to the tip of their fingernail. If this line has been stable for years, it's probably a harmless mole under the nail called a melanonychia. But if it's a new line or the line changes, thickens, darkens, becomes irregular, or the surrounding skin darkens, it could be a sign of subungual melanoma, a serious form of skin cancer that often occurs under fingernails or toenails. Early melanoma might not hurt or itch, so these changes are easily missed until it's advanced. If you see a line wider than 3 millimeters with jagged or irregular borders, nail splitting, or pigment spreading on the skin around the nail, seek a dermatologist immediately. They can perform a biopsy or specialized nail examination to diagnose it early. 3. Terry's nails, white nails with a pink band. Some people develop nails that are mostly white with just a small pink or brown band near the tip. This pattern is known as Terry's nails, first described by an American physician in the 1950s. Terry's nails often indicate a liver cirrhosis, chronic heart failure, diabetes, poorly controlled, malnutrition or protein deficiency. It is caused by changes in blood flow and protein levels under the nail bed. If multiple nails show this pattern persistently, it's a sign you should get evaluated for these underlying conditions. 4. Other nail changes. Yellowing and thickening. Usually a fungal infection, but can be linked to chronic lung diseases or lymphatic blockages. Vertical or horizontal ridges might indicate chronic illness, nutritional deficiency, or recent serious illness. Spoon nails, concave shape, can be caused by iron deficiency anemia or thyroid problems. If you notice persistent changes in your nails along with other symptoms, consult your primary care doctor or a specialist. The big takeaway: don't ignore your hands. Your hands and nails are amazing indicators of your health. While not every change means cancer or something serious, they are often your body's earliest warning signs. Especially if you have risk factors like smoking, chronic diseases, or a family history of cancer, it's important to pay close attention. Take the time to examine your hands regularly. And if you notice anything unusual, changes in finger shape, nail color, lines, or new spots, don't shrug it off or wait it out. Go see your doctor. Early diagnosis can make a huge difference in treatment and survival. Remember Lisa's story? A friend noticed changes before symptoms appeared, and that friend's comment ultimately could have saved her life if only she'd listened sooner. Your hands might just be the quiet heroes in your health story. Don't ignore what they're trying to tell you. Beyond cancer signals, what changes in your hands reveal about your longevity and quality of life? When we talk about health warning signs, cancer symptoms often come to mind first. But what if I told you that changes in your hands might reveal something just as important, or even more long-term, about your overall health, your lifespan, and the quality of your daily life? Let's start with a simple example. Have you noticed that your hands have been tingling or going numb recently? Maybe your grip feels weaker, or your handwriting isn't as smooth as it used to be. Meet Jessica, a 68-year-old school teacher from Ohio. She recently started feeling a strange numbness in her fingers and noticed that she sometimes drops her coffee cup. Many people would brush this off as just getting older, but these subtle signs can be your body quietly signaling something more serious. Can you really predict how long someone will live just by looking at their hands? There's an old saying in some cultures, kind of like the Western idea of reading palms or telling fortunes, that goes, you can tell how long a 70-year-old will live just by looking at their hands. Sounds like folklore, right? But surprisingly, there's quite a bit of truth in it. Both traditional medicine and modern science agree that your hands are an excellent indicator of your health. Why? because the palms and fingers are at the very ends of your limbs, the farthest points from your heart. This means they are the first places to show signs of changes in your blood circulation and nerve function. When your body is functioning well, your hands tend to have a healthy color, normal warmth, good strength, and flexibility. On the other hand, pun intended, when some systems start to decline, your hands often show the earliest warning signs. What if your hands often feel numb? Jessica, like many others, experienced tingling and numbness in her fingers for months. She ignored it, thinking it was just age catching up. But in fact, persistent numbness or weakness in the fingers can be a red flag for nerve or circulation problems. From a medical standpoint, these symptoms often indicate nerve compression or injury, such as from cervical spine, neck arthritis, or a herniated disc pressing on the nerves that go down your arm. Carpal tunnel syndrome, which is when the median nerve inside the wrist gets compressed, a common condition, especially for people who spend hours typing or doing repetitive hand movements. Peripheral neuropathy, often caused by diabetes, that damages nerves and leads to numbness, burning sensations, or weakness in hands and feet. More serious causes like strokes or spinal cord diseases, which can cause numbness or weakness on one or both sides of the body. If you ever notice that your hand numbness is accompanied by symptoms like dizziness, slurred speech, facial drooping, or weakness on one side, seek emergency medical help immediately. These could be signs of a stroke. When your hands feel cold and your fingers turn purple, blood flow problems. Have you ever experienced cold hands and purple fingertips, even when it's not particularly cold outside? Take David, a 72-year-old accountant from Chicago, who often complains his hands are icy to the touch, with his fingers turning a bluish hue, especially after he's been sitting for a while. This isn't just discomfort, it might indicate problems with blood circulation or even anemia, low red blood cell count. The small arteries and blood vessels in your fingers are very sensitive. When they don't get enough oxygen-rich blood due to narrowing arteries, poor circulation, or blood disorders, your fingers may feel cold, change color, and even develop numbness or pain. Common reasons for these symptoms include peripheral artery disease, PAD, a form of atherosclerosis where arteries narrow, reducing blood flow, especially common in people with diabetes, high cholesterol, or high blood pressure. Raynaud's phenomenon, where cold or stress causes blood vessels to spasm and temporarily restrict blood flow to fingers and toes, causing them to turn white or blue. Anemia, particularly iron deficiency anemia, which reduces oxygen delivery to tissues and can cause fatigue and cold extremities. Heart problems that reduce cardiac output, meaning less blood reaches the far ends of your limbs. If your fingertips are not just discolored but also painful, numb, or slow to heal from minor cuts, this might indicate serious blood vessel blockages or complications from diabetes. Stiff and deformed fingers, joint degeneration, and its impact on daily life. Now, imagine waking up one morning and your fingers feel stiff, swollen, and painful. You find it hard to make a fist, button your shirt, or hold a fork. This is a common experience for many older adults like Margaret, a 75-year-old retired librarian from Seattle. Over time, joint stiffness and deformities in the fingers can signal chronic joint diseases, such as osteoarthritis, the wear and tear arthritis most common in older adults, affecting the finger joints, especially the thumbs and knuckles. It causes swelling, pain, and limited movement. Rheumatoid arthritis, an autoimmune disease where the body's immune system attacks the joints, causing inflammation, swelling, and deformity, often symmetrically in both hands. Gout, a form of arthritis caused by uric acid crystals accumulating in joints, leading to sudden, painful flare-ups. While these conditions may not directly shorten lifespan, they can severely affect quality of life, making basic activities like dressing, eating, or walking more difficult. In fact, poor hand function can contribute to reduced mobility, increased risk of falls, and a downward spiral into dependence. Important tips for those over 70. 4 things to avoid for a long, healthy life. After 70, our bodies start to slow down, organs and tissues don't work as efficiently as they used to. To live well into your 70s, 80s, and beyond, it's important to avoid certain habits that can hurt your health. 1. Don't rush to exercise early in the morning, especially outdoors. Many retirees like Frank, a 74-year-old veteran, love to start their day with an early morning walk or hike. However, the early hours, especially before sunrise, are when the risk of strokes and heart attacks is highest. Blood tends to be thicker, blood pressure can fluctuate, and cold temperatures cause blood vessels to constrict, all raising the risk of dangerous blood clots. Instead, warm up indoors for 10 to 15 minutes after waking up. If you do go outside, avoid fasting, don't go on an empty stomach, and wear appropriate clothing to stay warm. 2. Avoid washing your hair or taking showers right after waking. In the morning, your body systems are still waking up. A sudden shower, especially with hot or cold water, can cause blood pressure spikes or drops, putting strain on your heart and brain blood vessels. For people with heart or vascular conditions, this could trigger an accident. Better to wait until after breakfast or later in the day when your body has fully activated. Use water that's close to your body temperature to avoid shocking your circulation. 3. Don't let yourself get angry or stressed too often. Mental health is deeply connected to physical health. Studies in the U.S. have found that up to 90% of illnesses have some link to emotional stress. Chronic anger, anxiety, and depression don't just affect your mood. They can disrupt your immune system, hormone balance, and even damage organs. People over 70 with calm, stable personalities tend to have lower mortality rates. So, practice letting go, don't get stuck in anger or frustration, and adopt a relaxed, easygoing attitude. 4. Don't sit or lie down too much. Many older adults become sedentary, especially when they feel unwell. But sitting or lying for long periods accelerates muscle loss, weakens bones, slows digestion, and increases risk for dangerous blood clots in the legs or lungs. Make it a habit to get up every hour, walk around for a few minutes, and do gentle stretching. Even when sick, sitting up for part of the day helps maintain function. Conclusion, your body talks. Are you willing to listen? After 70, the choices you make every day, how you move, how you respond emotionally, and how you care for your body will determine not just how long you live, but how well you live. Your hands are one of the most telling parts of your body, silently signaling your internal health status. By paying attention to changes in your hands, whether it's numbness, color changes, stiffness, or weakness, you can catch problems early and intervene. Aging doesn't have to mean decline and suffering. With small but consistent changes, taking an extra walk, adjusting habits, managing stress, and seeking medical advice promptly, you can enjoy your golden years with strength, independence, and peace. Thank you so much for watching or reading this detailed health guide today. If you found it helpful, please consider subscribing or following for daily tips to support your well-being. Let's grow together, live happily, and age gracefully. Until next time, take care of your hands and yourself.